Hi everyone. This is a video about the difference between doing a provoked urine toxic metals test looking for heavy metals versus using a blood test looking for toxic metals. Heavy metals, toxic metals would include things like aluminum, cadmium, lead, mercury, arsenic, nickel, and there's a few other miscellaneous ones that are quite rarely elevated in people unless they're working in a certain type of industry, like you might find uranium in some folks, or tungsten or things like that. But they're pretty rare. I don't really see those popping up in practice too often. And the difference, because I talk to folks about heavy metals regularly, in part because a lot of my patients who are dealing with complex chronic illness, they have issues with elevated heavy metals in their body for a variety of reasons. And we talk about heavy metals, and sometimes I'll mention, oh, we should look at testing you for heavy metals. And sometimes they say, oh, I've already been tested for that. I had a blood test for lead or mercury or whatnot, and it came back just fine. So I've already checked that off the list. That's great. And what isn't explained to them leading up to that point, then I explain it to them, is that blood testing is generally the gold standard looking for heavy metal poisoning. So if a person has been exposed to high levels of lead or mercury, cadmium, one of these metals in recent past, then their blood levels are going to be elevated. Or if there's an ongoing fairly high level of exposure, then their blood levels are going to be elevated. But after that exposure is gone, or if there's not a high level of ongoing exposure, there isn't going to be elevated levels in the blood. They're just going to come back looking normal. So to find what we're ultimately trying to figure out is, are there elevated metals in the tissues in the body, like hiding out in or around the cells? The body quickly tries to get those heavy metals out of the bloodstream as quickly as possible because they're really, really, really toxic. They're directly toxic to our mitochondria. They increase the level of free radicals in our bodies, and both of those things are really bad for us. They perpetuate a lot of disease symptoms. They set the stage for degeneration in the body's tissues, so just really, really bad. That's why heavy metals are such a problem for human health. So the body gets them the heck out of the blood as quickly as possible. So when we're searching for them in the blood, again, unless there's an ongoing or high level of exposure, then we're not going to likely see anything coming up in the blood. So what we need to do is something called a provoked test. And a provoked test is where we administer a chelating agent, which is a heavy metal binding agent that goes into the tissues, into the cells or the area around the cells, binds up the metals, and then ultimately dumps them out into the bloodstream, which will then be filtered through the kidneys, come out, processed through the liver, passing into the stool, etc. Sweat it out a little bit, breathe it out a little bit, but primarily bowel and bladder, we're going to flush those out. So in other words, you need to, the way I kind of frame it for my patients is we kind of need to rustle the bushes a little bit to get those metals out into the open so we can actually detect them. The most common way of doing a provoked test, and to my knowledge, pretty much the only reliable way of doing a provoked test, is by using urine. And so the test process that I use, and as I was taught when I did this training many, many moons ago through the American College for the Advancement of Medicine, or ACAM for short, considered, to my understanding, to be one of the leading authorities in North America of training folks, clinicians in chelation therapy and testing and all of that with heavy metals. And the protocol I use is I recommend that patients do a baseline urine test. So they should collect just a first morning random urine sample to get a baseline, so we know how much metal are they flushing out on a regular basis, and that's just on an average day. And then they have the chelating agent administered. Ideally, we use an intravenous chelating agent, combination of calcium, EDTA, sometimes disodium EDTA, but usually calcium, or DMPS, or in some cases we will use an oral chelating agent if distance or needle aversion or something like that is a factor. And so they can either swallow or have an intravenous infusion of the chelator. The chelator then goes into the tissues, once again binds up those metals, dumps them out through the bowel and bladder, and then ultimately the patient will collect another urine sample after that's been done, so that we see how much metal is coming out. So the way I frame it is that it's like we're going fishing for heavy metals, and so we look at the follow-up urine sample and we see, well, compared to the baseline, to what extent did that level of metal elevate? And if it goes up by a large enough magnitude, we'd say, well, we went fishing for metals in your tissues and we found a significant amount, and so it looks like you have elevated levels of that particular metal in your tissues, and so maybe we should do chelation therapy or some other type of treatment to try to get those levels down. So that's essentially a provoked test for heavy metals in a nutshell. When we do these panels, it tests for every single heavy metal, so all the ones I mentioned earlier and the obscure ones. So it's not like we have to pick and choose which metals are we going to test for. We just get the whole shebang. And in my experience, it can be really useful looking for those heavy metals and getting rid of them if they are elevated, because sometimes that's what's holding a lot of patients back. I've had some patients where they're doing really well, they're improving a lot, but then they hit a plateau, and it isn't until we identify and remove those heavy metals that they will get all the way better, or at least move on to the next level of improvement before maybe there's some other thing we need to figure out. Sometimes there's multiple layers, but heavy metals can be an important one. So I hope that is interesting and useful, and if you have any questions or comments, just leave them in the section below.